So in general, there's two options. The one is quite a common procedure, something known as an arthroscopy or keyhole surgery. And what that involves is using small incisions to essentially go inside the ankle joint, have a look around, clear up tissue which is slightly worn out. And as long as it's small focal areas of arthritis, it works actually very well. And that's one type. And then the other type depends a little bit on the type of arthritis that there is, but it's something called an osteotomy. And that's where if there's an angular deformity within the joint, then the bones can essentially be cut. So the shin bone and maybe the heel bone and the other bone called the fibula, and they can then be cut and repositioned into a new position to offload the area of arthritis and load the sort of more normal parts of the ankle joint. So essentially it's two types of operation, either keyhole surgery or an osteotomy. So joint preservation surgery tends to work well when you've actually already got reasonable areas of cartilage which can take some of the load. So if, for example, the entire joint is worn out, then actually that's a poor candidate. But if you've got areas of the joint which are actually still effective, then and that joint can then accommodate that, then actually they're the good candidates. So the mild to moderate arthritis is definitely the better candidate for joint preservation, but the severe arthritis tends to do better with either a fusion or a replacement. Well, the good thing about both of those procedures is actually they keep mobility going. So one of the things patients are always worried about with a fusion is that you'll stiffen up the joint. Whereas with a joint preservation, you keep the joint and therefore you keep mobility. So they're very good at not only keeping mobility, but also improving it. And then in terms of relieving pain, they can actually work in a very similar manner to a fusion or a replacement in the right patient. So both are very good for both relieving pain and improving mobility. And the good thing about them is if they don't work, then you've still got the back out option, which is either a fusion or a replacement at a later stage. Yeah, so essentially when we talk about joint preservation techniques without surgery, what we're really referring to are the non-operative steps of arthritis management. So they would be things like physiotherapy, which are very good for improving the mechanics of both the foot and the ankle and also the body in general, as well as making sure that the right footwear and insoles are used to ensure that the joint is loaded in a less demanding way. And then finally, you'll have things like injections. And injections which are good are generally one of three types. There could be a corticosteroid injection, there could be a PRP injection, or there could be a hyaluronic acid injection. And each one has its good points and its bad points. So the good thing about a steroid injection is that it's very reliable. It tends to work very quickly. And actually, when it does last, it can last anywhere from a few months to a few years in some cases. PRP is a more novel type of injection. And one of the reasons it gets a bad press is because not all PRP injections are the same. There are different preparations of PRP, and that can mean what one person receives in one clinic is different to what another patient receives in another clinic. The final thing is a hyaluronic acid. Hyaluronic acid is a component that's naturally found in joints, but when it works as an injectable, what it's actually doing is working more as an anti-inflammatory. But the good thing about it is it doesn't wear out the cartilage in the same way that a corticosteroid can. So there's a theoretical chance that it can be used for a lot longer. So if we're talking about the non-surgical joint preservation techniques, such as injections, well, they can last anywhere from 1 to 2 years to sometimes longer. With an operation, it's a much more definitive procedure. So the result can actually last a number of years, anywhere from 10 to 15 years. Now, the reality is that we probably don't have enough good data on joint preservation techniques beyond that time frame to say they'll last much longer than that. But certainly within the wider literature, we can say that at least 10 to 15 years, as long as it's done for the correct indication and done well.